Sarah Spencer with 98.9 WOKO. My guest is the Associate Director of the VA, Becky Rhoads. And Becky, thank you so very much for being here. You're with the White River Junction Department. Is that correct? You're
Yeah, White
Chief of
River
Operations?
Junction VA Medical Center. We really appreciate the opportunity to be here today.
Oh, well, we appreciate having this information to pass on to veterans because there's a lot of myths out there, and we're going to try to clarify that. And also, what do you do as a veteran? What are some of the things that you can do if you're a veteran and you'd like to become enrolled and you'd like to have a COVID-19 vaccination? How does that all work?
Great question. So we are able to vaccinate all enrolled veterans. And so when we talk about enrolling, it means that we're able to provide healthcare to you, that you're signed up and sort of in our system. And we have a fantastic enrollment team who is willing and eager to help anybody who isn't sure about their enrollment status or wants to check and see if they're eligible to be enrolled. They can come in person to White River Junction to do that. They can email us and call us on the phone. The big thing that people need to bring is their DD-214, which is essentially their discharge document. Most veterans have a copy of that. If they don't, any military documentation and our enrollment team can work their magic and pull things from behind the scenes to check and see if someone is eligible.
Now, how do veterans contact the eligibility team? Is it email? You mentioned phone call, anything like that?
Sure. So they can call them directly. The phone number for our eligibility team is 802-295-9363. And then their direct extension is 4004.
Now, what are the impacts of no-shows and cancellations? How is that handled?
So we have essentially a zero waste policy with this vaccine. As everyone knows, there's not a lot of vaccine. There's much more demand than there is supply of the vaccine. And so we work really hard to make sure that we have people on site or nearby that we can call in case we have a cancellation or no show. And our goal is to not waste a single dose of the vaccine. And so we have backup lists and we reach out all day, every day with a specific call center group that's calling eligible veterans to see if they're interested in coming in to get the vaccine.
Now, are you segmenting the ages? Like, is there a certain age that needs to come in, or is it open to veterans as long as they have the documentation and they've made an appointment?
So we're following the CDC guidelines in terms of starting with the oldest veterans first. And that's the focus of our call center. We don't want to miss anybody in the 75 plus, 85 plus age group that's interested that may not be on Facebook or listening to this radio station to know that they're eligible. So that's one way that we're doing it. And right now we're going to the 55 and older group. So any veteran enrolled for healthcare within VA is eligible to come in the 55 and older group.
Oh, wow. That's younger than the state of Vermont. I think we're at 65 plus. So that's great that
It's a
55.
benefit of
Yeah.
one of many of being a veteran. And of course, we want folks to get the vaccine whenever they are able, whatever's most convenient for them. So if that means getting it through the state, fantastic. We're happy they're getting vaccinated, but we want to offer it to as many veterans as want to come and see us for the vaccine.
Now, some are asking, why is it so complicated to get this particular vaccine? Can you shed some light on that?
Absolutely. So the COVID-19 vaccine is authorized under what's called an emergency use authorization, and it just has more strict guidelines for both storage and handling than your typical flu vaccine. And that just means that there's a lot more people and process involved in getting the vaccine distributed. So we think of the really sort of easy to set up drive-through flu clinics. Some places are doing drive-through for this, but it just requires a lot more manpower and process in order to make sure that you're keeping the vaccine at the right temperature. You know, as people might know that the Pfizer vaccine has to be kept at super low temperatures until it's ready to be used. The Moderna vaccine, which is the vaccine that White River Junction is administering, also has very strict, not quite as cold requirements for both freezer and refrigerated temperatures. And so because it's under the emergency use authorization, there's no straying from any of those guidelines that we have to follow.
And how long does it take to get your shot?
The actual shot takes about 4 seconds to go in your arm. The thing that's a little bit more time consuming is that we're required to monitor folks for 15 minutes after they get the vaccine. So if you include all the come in, check in for your appointment, get seated, get the vaccine, it's usually about 30 minutes people can be in and out the door.
And there's a few myths that some people have, and I'd like to clarify those a little bit. Some of the questions for the myths anyway. Can you get COVID-19 from receiving the vaccine?
So the factual answer to that is no, you cannot get COVID-19 from receiving the vaccine. The COVID-19 vaccines do not contain the SARS-CoV-2 virus. There's mRNA in this vaccine, which helps the human cells make a protein that triggers the immune response, which is different than other types of vaccines that people have gotten previously.
And if you've already had COVID-19, do you still need the vaccine?
You should absolutely still get the vaccine.
Really?
The experts don't know right now how long your previous coronavirus infection actually protects you against getting COVID-19. And so when enough people are vaccinated, it's harder for the disease to spread, which is why we're promoting vaccine, because that community immunity prevents the virus from traveling as easily from person to person.
And can the COVID-19 vaccines cause severe side effects?
So most people have no significant reactions. It does cause some side effects, which can be including fever, chills, joint pain, headaches. Allergic reactions to this vaccine, while they're more common than with other vaccines, they're still exceedingly rare. And even the risks associated with that allergic reaction are still less than the risk of getting COVID-19.
Wow, that's really good to know. So even if someone had I can speak, allergic reaction to penicillin, would they still be okay to get the COVID-19?
So that would be a
Vaccine?
question I would encourage folks to talk with their doctor about if they've had allergic reactions to other vaccines in the past. That can be a contraindication, but that's a conversation to have with their physician. And definitely want to assure everybody that all the vaccine sites are well equipped to handle any allergic reaction that may happen at the point of vaccination.
And that's why you have them wait a bit after having the vaccination. So that's great. Okay.
Exactly.
Now, there are concerns out there about the COVID-19 vaccine altering your DNA. What do you say to that?
I've heard that one as well. No, the mRNA vaccine, which is the type of COVID-19 vaccine, protects us from COVID-19, but it does not alter the DNA. These kinds of vaccines work outside of the cell's nucleus, which is where our DNA is located, and it teaches the cells in the body how to make a protein that triggers the immune response. Our cells are able to break down and get rid of that mRNA soon after they're finished using what's been in there. It's a marvel of science, honestly, that we're using mRNA vaccines and that we're talking about vaccinations, just over a year after coronavirus became sort of a common household thing.
Yeah, that's a miracle, actually, that we have vaccines this.
Absolutely.
Thank goodness. So another question, can you stop wearing the mask once you've had the COVID-19 vaccine?
So we still recommend that you wear a mask even after getting the vaccination. The vaccine may prevent you from getting sick, but we don't know if it prevents it from getting into your body, and we don't know if you're still able to carry and transmit the virus to others. So even after getting the vaccine, we still recommend practicing all of the precautions we've all gotten used to, which are physical distancing when in public and wearing a mask when in public.
Now, there are concerns about the vaccine being unsafe because they were developed so quickly. I mean, we just talked about that. What are your thoughts on that?
So even though the COVID-19 vaccine is authorized right now under what's called an emergency use authorization, the same steps were taken to get to this point as with the full-term clinical trials. They tested this vaccine on thousands of human participants, and it's only the consolidated timeline which gets us to the emergency use authorization. But multiple agencies have worked together to ensure that the vaccine is safe and effective.
We've been speaking with the Associate Director, Becky Rhoads of the VA in White River Junction. Yes? Okay, I want to make sure I have the right town for you. And if someone wanted more information, where do they go for? Is there a website or a place they can visit?
So our website they can go to our website, which is the www.whiteriver.va.gov. Under our healthcare services, we have a drop down under the COVID-19 vaccine, where there is a plethora of information, both that links to national sources like the CDC, and then also how our local rollout of vaccination is going.
Wonderful. Becky Rhoads, thank you so much for being on the show.
Thank you for having us.
Thanks for being here. I'm Sarah Spencer with 98.9 WOKO.